Well, hello and welcome back to another Unscripted Surgical with Dr. Richard Farnam. I'm here with Dr. Abhi, just an absolute brilliant entrepreneur in the medical field. He has pioneered a technique for relieving chronic nerve pain by using an amniotic derivative without stem cells. And I'm fascinated personally to learn about this, and maybe you can tell us a little bit about your background and how you get into this.
Sure. So thanks for the opportunity to share what we're doing. So basically, fundamentally, I'm an anesthesiologist by training, and I'm just innately always trying to find a better way to solve the problems. And pain management in and of itself is a moniker that makes me uncomfortable. Right? Who wants to manage pain? Right? We want to cure things or resolve them rather. So a quick and dirty is basically a human being is a machine, just like a car, right? And these machines have a schema that's associated with them, right? So nerves travel in a particular plane of the body, and what we've done is we've discovered a way to high fidelity linear ultrasound probes and then intervene on areas of soft tissue that have been compromised and freeing up the nerves in the case of chronic pain. So people typically, there's a lot of people in the States or all over the world who are suffering. They go get an MRI, it comes back negative, and then the doctors either tell them they're crazy, right, or send them to pain management, or basically send them down a pathway that isn't really solving the problem or easing the suffering.
I'm here with Dr. Sanjay Raval. We had heard earlier with Dr. Abhi about his relief amniotic derivative injective for chronic pain. And Sanjay has actually undergone this procedure, and we're very curious to know what the results have been.
Cool. So I've been playing squash for about 20 years, and I suffered from an injury on my right ankle from an Achilles rupture, and I'd been really struggling for a long time. I had a lot of pain all the time, especially after hard training sessions or exercising, jumping up and down, running especially, and after Dr. Abhi's treatment, I could certainly feel relief straight away, actually. And it really helped me. I could actually feel my tissue start moving again, so I had mobility in my Achilles, and within a couple of days I was actually pretty much pain-free, and this was about 3 months ago, and whenever I've been exercising, when I've been jumping up and down, running intensely, I've actually had no pain whatsoever. I stretch a lot, that definitely helps, and it's been a really, really great experience.
And what are the conventional options that are offered by the physicians and surgeons that you had seen when the injury occurred?
Yeah. So when the injury occurred, it was actually wrongly diagnosed. So the treatment plan was wrong at the time, which then caused my injury to actually turn chronic for a very long time. And the only thing that relieved that a little bit after wearing years ankle support, the only thing that really relieved the pain was actually changing my diet a little bit and adding some nutritional supplements.
I guess one of the questions that I would have for you is, what's the duration of effects and how many treatments did you end up needing?
So I had my first procedure done beginning of December. I had my second procedure done towards the end of January. So it's about 6 weeks in between. But you mustn't forget I had an injury that I sustained in 2003. So that's been it was 16 and a half years of chronic injury that I had in my Achilles, and obviously with huge intense amount of exercise all the time.
So at this point, what is your baseline pain level, if any, and what is pain level with exertion? And then just for contrast, compared to prior to treatment.
So prior to treatment, I would definitely find after intense exercise, I would have some form of moderate pain. But more than that, I would be cautious. I would be cautious when I was training. I would be cautious when I was exercising. Any form of intense exercise has not caused me to have any pain whatsoever. I always feel like I've got a new Achilles.
Wow. And so you felt the ability to exercise and do things in an unrestricted way?
Absolutely.
That you were. And if you would just let everybody know what your practice is and where in Germany?
I've been an orthodontist for just under 10 years. I've been practicing dentistry for over 15 years. I have a big orthodontic office in South Germany.
We're blessed to have the opportunity to have Sanjay come speak with us. And if you have any questions, how could they come in contact with you?
You could definitely send me an email at sanjayraval@web.de.
What we're doing is fundamentally listening to patients, right? Because I believe patients know their bodies better than you, I, or any physician, right? And then being able to reconcile what somebody is feeling with what we see on ultrasound.
That's fantastic. And so, as a urogynecologist, pelvic pain surgeon, exactly what you're saying. We see these patients; they come with problems. I can cure their organic disease,
Sure.
but that's only a percentage. That's only a percentage of what's going on. I'm always fascinated with learning other ways that we can do minimally invasive techniques. So I'm interested about the chronic pain aspects of what you're doing.
Sure.
And maybe you can explain for us what the injection consists of,
Sure.
and then how that might be useful for female pelvic pain.
Yeah, sure. So, essentially what we're doing is we're leveraging the power of females, right, and their anatomy, because the life force is within every female, right? Every human being is a living example of what is this magic that happens in utero and its ability to create life, at warp speed, right? I mean, in 9 months you go from sperm and an egg to a baby, right?
It's amazing.
It's incredible, right? I mean, that's a whole other topic of conversation. But basically what we're doing is healthy moms who are scheduled to undergo C-section, instead of that afterbirth being incinerated, and it's actually a travesty because the hospitals have to pay to dispose of this basically gold. Our partners recover this material, after the expectant mom is consented. That material is then processed, in an FDA certified facility where it's the amniotic membrane is the inner lining of the placenta, right? So they separate that amniotic membrane lining from the chorionic lining, right, which contains some maternal antibodies, right? So essentially, what we're left with is a completely immune privileged biological layer, which we then morselize, put into saline, and that extracts out all of the water, the water soluble proteins. Those proteins are then concentrated, gamma irradiated, so there's no cells, right? And essentially what we're doing is we're speaking the language of the human body, right? Because how does a sperm and an egg become a human being? It's this magical milieu that is secreted by the amniotic stem cells that reside within the amniotic membrane. And those cells are producing this concoction, right, of proteins. And we've done antibody ELISA assays that show, about 150 different active cytokines, right?
Fantastic, yeah.
So again, typically, modern medicine tries to reduce things down as much as they can. So how do we prevent something? Well, we have to find this one molecule, right? I see things kind of differently, more so in a symphonic way, right? So if a symphony consists of many instruments, right, if one of those instruments goes out of whack, the whole song is off,
yeah.
Right? So it's the same thing with our biology. So I'm not pretending to know how exactly this is working, right? I just know that this milieu that is responsible for you and I being here, we're taking that and leveraging it in a way that we can help people's biology. So specifically for chronic pelvic pain, female anatomy, there's more gear, for lack of a better word, inside of a smaller space, right? So any kind of anatomical disturbance that can occur, whether it's from disease, poor biomechanics, et cetera, that can have undue effects downstream. Some of those can be chronic pain, infertility, et cetera, right? We're just kind of scratching the surface of these scenarios, but for pain specifically, let's divide pain into two categories. You have neurogenic pain, so that's if a woman is feeling burning, almost like electricity down there. The other more kind of common pain is one that is generated from the connective tissue, right? So the connective tissue plane has more nerve innervations than any other layer of the body, right? This is what allows us to kind of have a mental map of our own being, right? So when this layer gets perturbed, you can get chronic pain from just like for your patients that are feeling tightness all the time,
right?
that is likely not coming from a nerve, but connective tissue abnormalities.
And I think this is important for us as surgical providers to understand that it goes beyond just the organic disease. There are other processes going on. So I have one more question. A lot of us have heard of the concept of using the amniotic layer with the stem cells because these stem cells represent the ability of a cell to come in contact with other tissue and then differentiate into that tissue it comes in contact with. What's the advantage here?
So the advantage here is one, when you're giving stem cells to folks, you run the risk of having, anaphylaxis, right, subacutely, but, you can get an immune response to the cells, right? Additionally, I feel personally you're almost kind of rolling the dice if you're just giving cells because you're just giving a immature but highly, a cell with a lot of potential, and you're placing it in an inflammatory environment. So what we're doing is the amniotic fluid that we're using is modulating that inflammation, and then the volume that I'm giving is activating these telocytes, right, which are a brand new cell that they just discovered, a handful of years ago, that essentially are the adult, mature version of the amniotic stem cell. So these telocytes are the only, there's only two immortal cells that exist: cancer cells and these amniotic stem cells, or telocytes in the mature body. So telocytes are able to differentiate right into whatever is necessary, and I believe, right, the human body, we all have billions of stem cells inside of us. It's just how do you turn those things on, and that's what I feel we're starting to figure out.
Well, this is wonderful. If providers, patients that want answers to some of their questions, how can they reach you?
They can go to www.I, so the letter I, the number 2, the letter I.md. So www.i2i.md, which is short for Intuitive Interventions.
Fantastic. Well, thank you so much for your time. I know you're amazingly busy. Thank you.
Have a good one.